Tanya. We are your companions in health because everybody needs a friend who's on their side when they're navigating one of the most challenging experiences in their life. You want your family and loved ones, your trusted circle, to be with you, connected, informed, and empowered in that journey. So what is it like as a patient in the health system? There are many challenges which we've uncovered. Hospitals as well as patients encounter these problems. How do I find who's looking after my parent? Who has told who what? How do I convey that information to the rest of my family? The hospital staff, where has the patient gone? Oh, now we'll have to reschedule. So we want to address all of these problems, and we believe we have a solution. So I ask you, what if we properly connected healthcare and empowered patients? I'll tell you what, this is what someone said from Queensland's Health Consumers Organisation. I didn't know that I had this problem and I needed your solution until you created it for me. Thank you for giving me a voice. So we know there is a problem, we know that people want the solution, and both hospitals and consumers are willing to pay. And we have, in the time of the hackathon, created a minimum viable product and signed people up to test it. People want to give it a go. Now I want to show you what our minimum viable product looks like, so over to Oliver.
Thanks, Angela. So over the last couple of days, our team from Liquid State teamed up with the QUT team to produce this working MVP app. So this is a real app that we've been coding up. And as you can see here, it has a number of different features and functionalities that support the story that Angela's just been telling. So some of these high-level things are the ability to register in and connect up with your identifier in the hospital when you're in there, circle in your friends and family.
Can I find the way to where my dad is in hospital? Which ward?
Absolutely. So we have mocked up some wayfinding that could be used around hospitals. And we would also be hoping to connect with hospital integrations through middleware known as Iguana in order to get that information and make sure it's accurate, up to date.
Can I find out who is looking after my parent and what the latest update is?
Absolutely. Again, a similar situation. That information exists, but it can be hard to find. So we would take staff profiles from hospital information systems and make them available in the app. But one thing we wouldn't do is overwhelm you with information. Actually, we would be following along clinical care pathways to ensure that the contents, notifications, notes that you can make and everything else like that is only delivered to you or available to you at that stage in your pathway. So for instance, when you're in a diagnosis stage,
you had in the course of the 3 days quite a few people sign up. Can you talk us through that and how you went through that process?
Okay, so we did extensive research, qualitative, quantitative. We looked at case studies, in-depth interviews, really understanding the pain points and really understanding what people wanted. So we're really patient-focused. And we asked people, look, if you were given, understanding that you've all experienced these pains, if you were given an app that could solve these issues, would you like to sign up to an early test? And so 30% so far, checked it very early in the morning, wanted to do that. So
I think, is it right to say we would have interviewed over 100 people throughout the conference? So the team is really all over here and they've been putting in the hard yards to go and validate the idea with people here and the general public.
Yeah, the diverse stakeholders, so academics from QT and beyond, health practitioners, doctors, the nurses, actual hospital management, patients, carers, people that are suffering chronic conditions that really need our help.
Just a quick question regarding this, quite hospital focused, which is fantastic. There's clearly high need. Could you see capacity to beyond hospital into community-based potential?
May I take this one? Absolutely. One of the big challenges of a Hacking Health event like this is that you have to narrow down the scope so much.
Yep.
A very, very similar framework could be used for a range of different health applications, anything from hospitals, GPs, allied health, community health, as well. Effectively, the framework that powers this is all platform driven, so it's easy to roll out multiple iterations or even one single app that actually does everything with some kind of split paths depending on your use case.
Actually, with big data, we will improve the hospital service